we are here to talk about something very important. What's the deal with these little crystals that are in our ear?
What's the deal?
What's the deal? It's part 2 in our What's the Deal series. We talked a little bit last time about what's the deal with hair cells. Today we're talking about another part of the inner ear, often referred to as crystals. We want to talk a little bit about what they are and why it can be a problem when they get out of place.
So these little crystals are actually meant to be in your head, in your ear. They're located in your ear. And so the reason we have them is because we need weight in our head to kind of exaggerate motion. They're on top of little sensors that tell our brain exactly where we are in space. So if we're going in a swimming pool and we're swimming downward or we're coming back up, we know where we are, in large part because these crystals exaggerate the motion and our brain is then able to detect them.
You know, when people think of the ear, they think of hearing. And sometimes they don't always think about the balance organ of the inner ear. So it's pretty cool that these crystals help us know where we're at in space with some of that orientation. They're deep down inside the inner ear, like Dr. Luekenga explained, but sometimes they come out of place. Now, a blow to the head can sometimes jar them loose. Sometimes issues with the circulatory system, with blood flow and heart issues, can cause these crystals to come out of place. When they do, it causes some problems.
The little crystals break loose and they come loose, and instead of being in these little bulges here, they'll actually find themselves in the canal. And the crystals are not supposed to be in the canal.
When they're in the canal, they cause vertigo. People have positional vertigo. When they extend their head back and look one direction or another, the whole room will spin violently for maybe 10 or 15 seconds. And we do want to show you briefly today on how you can treat that problem.
Okay, so one of the ways that we figure out whether it's your crystals or whether it's just something else that's causing the vertigo or causing the dizziness or causing you to feel off balance is we look at your eyes. These goggles are wonderful because they allow us to see and video actually record your eye movements. So even if we miss something in real time, we can go back and watch it again.
We're here in our clinic right now. This is the room that we utilize to be able to test for dizziness and vertigo, test whether crystals are loose. These are the very goggles that we use when we're testing for vertigo. The patient wears these goggles, looks like they're going scuba diving. We take you through a series of tests that helps us to diagnose the problem. If it is the crystals, we can often treat it right here in the clinic. If it's something else, we can come up with a treatment plan on how to fix that problem.
Yeah, we're very interested and very passionate about helping individuals with dizzy issues. Of course, today we are mainly focusing on the crystals, and more than anything, just want you to know that we're happy to help. We're excited about these things. That's why we've invested in these technologies to help you out.